Well, spring is finally here. By this time of year, some of your healthy New Year's resolutions may have gotten a little harder.
Yeah, that's right. Joining us now from SouthCoast Health, Dr. Roy Flood, with some tips on a heart-healthy diet just in time for spring. Good morning.
Good morning to you both.
Thanks for being here.
Thank you for having me.
This can kind of be, spring is kind of like a new beginning, like a new chapter at this point of the year. So why is it important to kind of focus on heart-healthy lifestyles?
Well, I think heart healthy should be year-round, but it's especially hard after coming off of a big holiday season.
Yes.
People tend to be a little more lax in their eating habits. The weather's a little bit cooler, so it's harder to keep your usual exercise regimen. And now that spring is here, the temperatures are rising, it's time to get back into the swing of things.
Well, I can tell you, when I think of spring, I think of allergies and all of my issues with my nose and my eyes. Obviously there's medicine out there, but what do you suggest for people out there who are suffering?
Well, it's been a rough allergy season. I recommend, because in my world, we got to get the exercise in, regardless of allergy season, rain, etc. So indoors is always better than nothing. I prefer outside myself, but with the a wide array of gyms and other health facilities in the area, trying to get something on the inside is just as well. I even tell some of my patients that are not able to get out and go to a community center, etc., use your house. Walk around in the house. You can measure it out. You can get your measurements done and do it in a timed fashion. And it all counts. Yeah. It all counts.
Are there better times of day to work out as far as maybe the pollen goes? Because aren't there times when it's not as strong during certain parts of the day?
I'm not really sure about the pollen counts. I think a lot of it really depends on the type of plants that you have in your particular neighborhood or your area and what time of year and day that they are most plentiful in the air.
Very interesting. So what are some other advice you have for good, strong, habits you should form to really look after your heart?
Well, let's talk about it.
Yeah.
I think that the main thing is moderation.
Okay.
And I try to emphasize that all the time. There's a lot of tempting food, particularly when you live here in Savannah. So trying to keep a narrow course is very difficult. For me, my recommendations are always to maintain the highest proportion of your diet being fruit and vegetable based. So most people, if they can get in 4 or 5 servings of fruits and vegetables per day, number one, it fills you up. And number two, it really goes a long way to maintaining good cardiovascular health. People will often ask about meats, and it's not that meats are bad, but the fat content, the cholesterol content in a lot of the meats is not good for a heart-healthy diet. So we try to limit those. We definitely recommend the use of skinless meats. If you chicken, for instance, we try to recommend taking the skin off first before preparing it. Obviously, we prefer to avoid fried as much as possible. Baking, grilling, broiling, etc. All great tips. And then a colorful diet. If you can look at your plate and you see many different colors, that means that you're taking in a lot of antioxidants, and these are things that help the body do its job in a more efficient and heart-healthy fashion.
So a lot of times the studies go back and forth, but a little bit of red wine is heart-healthy as well, right?
Debatable. Debatable. But there's really been no proven problem with small amounts of red wine, particularly, and other types of alcohol, but it definitely has to be limited for obvious reasons.
Like you said, moderation. I know a lot of maybe fad diets right now focus on specific things like eliminating gluten or, whether it be the keto diet or the paleo diet. Why is it important to consult with your physician before you kind of go on those restrictive diets?
Well, for example, some of the very low carbohydrate diets, if people really adhere to them and they have not been properly educated on the pitfalls of the diet, can see significant changes in mood swings, fatigue, loss of consciousness, dizziness, headaches. So it's not, even though they're losing weight and they are getting healthy, their overall health may actually be worse than when they started the diet. So you really need to be careful and thoughtful in starting these diets, and don't do it by yourself if you're not well-trained in nutrition.
Great. Lots of good advice. Thank you, Dr. Flood.
You are very welcome.
Appreciate it.
Keep that diet colorful.
Yeah.
Indeed.
Easy.